Sa Baguio naman, kasi medyo mainit ang usapan. Let's go to Baguio. Okay, UP Baguio. Oh, UP Baguio.
Magandang umaga po.
Marami raw marijuana sa inyo. Totoo ba yan?
Hi. Medyo po.
Medyo.
Magandang umaga po mula sa UP Baguio po. Kasama po namin ang ilang estudyante ng school, ng university. At ang university naman po ay walang eksaktong stand kung kami po ay pumapabor sa legalization ng cannabis for medical use. Pero ang masasabi lang po namin is very open po kami sa possibilities for research and willing po kami na i-harness din ang aming mga local experts sa pag-conduct nitong research na to. Not necessarily na katulad ng nabanggit kanina ni Senator Soto na we rely on facilities from US or mga technologies from abroad. We have local experts naman that, who can do such researches. So, open po ang university for opportunities para dito sa possible medical use ng cannabis.
Maraming salamat. Maraming salamat. Is there any other question or comment that you would like to share with us?
Medyo may comment lang po yung isang estudyante namin. Madaming nagsasabing or pag-aaral na nagsasabing masama ang paggamit ng cannabis, masama sa kalusugan. Marami rin namang nagsasabing maigi itong lunas mula sa mga lunas ng mga ilang sakit. Pero bakit daw po yung mga doctors, physicians o mga expert mismo ang medyo magkakasalungat yung kanilang mga sinasabi? Gayong sila naman yung nasa larangan ng pag-aaral dito. So medyo kulang po sila at medyo opposite po yung view ng mga physicians. Meron nagsasabing maayos ito sa kalusugan, may nagsasabi rin na sama sa kalusugan. Yun na po.
Maraming salamat. Ganyan sa demokrasya eh. Kahit na tayo sa same profession, iba-ibang views, no? So, ganyan talaga. Teka, itong ating young man who is in blue. Please identify yourself.
Magandang umaga po sa lahat. Ako po si Dr. Jem Mutia. Actually po ako ay Lasal graduate pero naka-blue lang ako. Anyway, I do not represent any organization po. Gusto ko lang po i-throw into the debate yung fact po ng rescheduling of narcotics because currently po merong 4 grades po ang narcotics. Schedule 1, 2, 3, 4. 1 being the highest. Bababa po yan. No? Schedule 1, sinasabi po ng Schedule 1, no therapeutic benefit and very high potential for abuse. Nandun po ang marijuana, nandun po ang heroin. Schedule 2, may potential for abuse, but then meron ding potential benefit. Nandun po ang opioids na tinitake ng mga patients natin. Nandun po ang morphine, no? Alam po ito ng mga colleagues ko na doctors doon, mas may alam po sila. But what will rescheduling do? Rescheduling will it will not give access to yung mga recreational users because sabi nga, Schedule 2, there's a big difference from Schedule 1 to Schedule 2. Schedule 2, doctors must have license from PDEA. Okay? So, definitely, there will not be recreational use, but it will allow for clinically indicated cases, it will allow better research. So ma-address na po natin yung problems na sinabi kanina ni Dr. Gaco na not enough therapeutic studies. So if ma-reschedule natin siya, mas malalaman po natin ang mga dapat malaman. Plus, makaka-gain access po. Hindi na kailangan na critically ill na isang bulate na lang ang hindi nakakapirma, mamamatay na tsaka lang bibigyan ng cannabis. So, as indicated po by specialist, pwede na pong mabigyan. S2 po. Kahit mga buntis po binibigyan ng S2 na drugs. So, why is the government not considering rescheduling the narcotic from Schedule 1 to Schedule 2 and yung po sinasabing wala pa po siyang enough evidence to support its therapeutic claims, is there enough evidence to support that it has no medical application and has high potential for abuse? I would like to challenge the Schedule 1 status of cannabis. Thank you very much.
Sagutin natin yung tanong ni Dr. Motia kung incidentally from Lanao Norte, may kababayan. Fortunately, the Philippines will be represented by two directors from the New Jersey Drugs Board, and the House of Representatives will be represented by the chairman. On March 15, we were invited by the Commission on Narcotic Drugs sa United Nations to discuss the rescheduling of 1, 2, 3, 4. And rest assured, we will be bringing with you your suggestions. So, gagawin pa ito sa Vienna, Austria, March 15 to 21.
Ay, marami pong salamat. So, kakampi naman si Congressman Belmonte, so he will bring your advocacy.
Good morning po. I'm just an ordinary citizen, so I have a son who's also diagnosed with autism in December 2007. And then after a year, the developmental pediatrician who diagnosed my son changed the diagnosis of autism into abnormality of the nervous system. So from mental diagnosis of autism, it was changed to a medical one. And then we did a lot of tests, so genetic tests. So it proves that there's no genetic issues for my son's case, because we did it twice from two different neurologists in the U.S. and both result came back as normal. So this case of autism is not genetic. So we go to the next question. So why? So how come he had that? And with the test, so we got the laboratory test. So it turns out he had high levels of mercury, lead. So all of these toxic chemicals in his system was there. And the oxidative stress is high and all of those. So the doctor who also guided us, so gave us this treatments of, detoxing and all the other therapies, the traditional speech, OT, ABA, and so on. So from that time on, we're so grateful for all the progress. So he's in this recovery road, kumbaga. So currently, he's now in a mainstream school. But we still continue with speech kasi medyo ano pa rin, he still can't have a conversation yung talagang for a typical 10-year-old, but we're progressing. So this is a case where we found out that the cause of his autism is environmental. So because of with all of those tests that we did, and this is a kid that is vaccinated, from the time that he was born. And actually, even when I was pregnant, kasi sa US, when we moved there, so pregnant ako noon, they, since sabi niya, so you're from a third world country, and kailangan mong turukan na mga flu shots and all of those. Siyempre, very obedient ako, at saka yung husband ko, kasi US yan, diba? So, akala natin talagang, okay. So anyway, so we followed. So whatever the medical professionals in the United States recommended for a pregnant mom and for the schedule of the CDC of vaccines. So he had all the vaccines with the schedule ng CDC from the time he was born until he was close to 4 years old, kasi the diagnosis came before he turned 4. So with the researches that we had, so nag-stop kami vaccinating him when he was 4. So dun siya nag-progress with all of those interventions also that we did. Tsaka yun nga, since we found out na it's not genetic for our case. And chinek din namin siya, kasi meron din siyang episode sometimes na parang absence seizure. So this will be different from the Grand Mal, 'di ba? So meron siyang parang tulala, pero pag ginulat mo, he'll come back. So we've done the 24-hour EEG. Pero with the result nung yung EEG niya, hindi raw masyadong talagang severe yung seizure. So it's just absent seizure, kumbaga. Pero very, very mild, tsaka wala siyang behavior problems and so on. So kaya madaling case to. Kaya, pero we have a lot of interventions that we did na hindi naman sometimes talagang approve ng, yung talagang on our own siya. So, but going back, ang question ko talaga is, one is, I think with yung marijuana and with yung application nito with seizure, kasi seizure is just one component ng talagang sakit ng bata. So in the US, we have talaga autism with seizures, na maraming seizures yung mga bata. And all the rest of the mitochondrial disorder, dysfunction, and metabolic gut issues and so on. So it's a wide spectrum of illnesses per se, with yung sa ASD, Autism Spectrum Disorder. So, it's a multifaceted disorder.
So, no question.
Ang question ko is,
so many other people.
my question will be, ang dami. Kasi yung drugs na ginamit for kay Ma'am Cynthia, the Depakote, Risperdal, ang tanong ko is, kung na-approve to ng FDA and all the rest ng pharmaceutical, kung sino man nag-a-approve, ngayon nakikita natin yung side effects, di ba? Tsaka talagang ang dami ko na rin nababasa, and talagang friends ko from the US na nakita ko yung anak na talagang may side effects ang mga drugs na ito. So, bakit siya na-approve? Yun ang tanong ko.
Alright.
So, kasi ngayon, umaano yun na yung mga side effects. Tapos pangalawa, yung vaccines, wala namang research talaga ng vaccinated against unvaccinated kids. Na parang ang ano ko ngayon, so naghihigpit tayo dito, 'di ba, sa cannabis na 'to. Yung vaccines nga hindi naman tayo naghigpit sa pagdagsa ng 5-in-1 combo. At saka talagang pag inaral natin ang ingredients ng vaccine, merong aborted fetal. Tsaka talagang yung mga mercury na sinasabi nga na wala na raw pero hindi totoo. So parang ang ko doon, marami ring toxin sa vaccines pero inaalaw natin. Ang Department of Health talagang inaano siya, di ba?
Ina-announce.
Parang, lahat parang sapilitan na.
In the interest of time, can you just wind down?
So yun yung tanong ko, bakit yung mga may ibang drugs na ina-approve pero may side effects? Tapos yung study about vaccines and non-vax, tsaka kasi pinipilit kaming magpa-vaccine. Tapos yung last na lang is yung sa dinebunk na sinasabi ni FDA director na dinebunk na research. Meron din po naman kasi kaming sources na yung nasimira sa integrity ng doktor na nagki-care lang siya with the parents of the kids in the spectrum, hindi naman talaga, kumbaga siniraan lang siya ng Parma din. Kumbaga yung is talagang binayaran din ng Parma. So sa mga facts and kailangan makita natin lahat ng sides. Hindi lang isang side na binayaran ng Parma.
Hi, I'm from PCCS. I'd like to address, actually this is for the FDA. I've been researching, and there are a lot of establishments already, commercial establishments that have been selling hemp products as food supplements. And under 9165, I noticed that anything that's under the cannabis plant, extracts or even end products, is considered illegal. So how come we have establishments big major establishments that actually sell cannabis products labeled as hemp? And if it was possible, yes, there are. Here in the Philippines, yes.
Yeah, okay. So can we,
There are.
Mark, is that your question?
Oh, yes.
Yan na. Okay, can we take...
It's leading to that, but
Okay.
since it's already being sold and already being approved, then would it be possible to get some of these extracts that, let's say there's certain products that we can bring in that are just food supplements in the United States, and they're being sold federally, legally. If we can bring it here, under the importance that there are kids that need it right away, and we don't want to go through the process of going through the law and taking weeks and months, and we've had kids dying every month because
Okay.
I just like to address this because
All right.
I've been wondering
Okay,
about it
Mark.
for quite a while. Thank
Mark,
you. Thank you.
okay,
Thank you very much.
just one more question before we get the response. Oyi. Ganun na lang gawin natin 3 by 3, ha? Para-
Thank you. I'm Aurora de Dios from Women and Gender Institute of Miriam College and also the Philippine representative to ASEAN and once UN expert at the United Nations. I'd like to look at this issue from two perspectives. One is from the rights perspective, the right of people to health. And the second is the perspective of the well-being of human beings. Now, I also like to mention that while we are focusing on children now, I'd like you to also know that women are some of the primary sufferers of breast cancer, ovarian cancer, and that every day women are dying without any, meaningful medical attention except that which is available in the market, which, as everyone has shared, is toxic and really reduces the quality of life of human beings at the last moments of their life. So I think that not only are women sufferers, they're also the primary caregivers of those who suffer, as we heard from the mothers today. So I'd like to make 3 points. One is on the point of research. Something as urgent as this shouldn't take a lifetime to finish. Okay, we in the women's groups are willing to share in the research. We have health groups. We can help also to map the kind of suffering that women who have cancers are undergoing. Second, I think that with evidence-based research that is done in the Philippines, we can have a basis for some policy directions on this issue. And I would like to take note of all the assurances that we heard today that there must be strict regulation in accountability and with the added safeguard of monitoring. So aside from all these regulations, I think we should also add that in order to assuage people's fears about the abusive use of cannabis, that we should also put there the periodic assessment of the implementation of this new regulation. Thank you.
Thank you very much. So we have on the table, we have on the table issues like, number one, the vaccines are toxic, even with all the Lancet, debunking of research on vaccines. Still, I think we have oral testimonies that it had a very adverse effect on their children. So that's one point. And then the other is, well, wait a minute. If you allow health products with, cannabis into the country, then why are you not looking at allowing also these women with children who are suffering also have access to those? So maybe just a 1-minute response from, or you don't need to respond actually. So those are just the points that they made, no? So, the health products. The health products are allowed here, but they have banned substances. So, si Mark yun. Okay, so can we just have a 1-minute response?
From the health options. Healthy options.
We have not registered any product that contained hemp or marijuana. If you did your research, could you share that with the law enforcement agency called PIDEA?
No, what they're saying is, Dr. Go, what they're saying is it's already being sold in stores.
In the
So maybe PIDEA, you go to Healthy Options and you check the drugs. No, you raid them,
I'm Ray Villarin.
Ray Villarin, go ahead.
Una, anong klase o meron bang specific pa na klase ng marijuana na nire-recommend yung nagpo-promote, no? Number 1. Number 2, yung eldest son ko kasi ay 24 years old na at is taking siguro lahat ng klase ng gamot din na anti-epileptic drugs, no? For more than 18 years, halos hindi nakokontrol yung seizure niya. So, wala kaming option din. Actually, hanggang ngayon, no, gusto namin subukan yung marijuana, no?
May pulis dito.
Yeah. Yun nga ho, itatanong ko ho ng direktahan. No? Ikukulong niyo ho ba ako? Kung ako'y magtatanim at susubukan ang marijuana. Okay? Kasi, yun lang ho yung tanong ko, no? Yun nga, huwag ako papahuli. Kasi, sa totoo lang ho, no? Inoperahan ng anak ko, sinubukan na lahat ng gamot, inubos na yung pera ng pamilya. Lahat ho yan, FDA-approved medical, Western medicine na pamamaraan, ginawa na namin. So, anong options, no? Yun yung tanong ko lang ho. Gusto ho namin magtanim. Gusto ko magsubok. At kung kukulong nyo ako, sana may pananagutan din kayo. Yun lang ho.
Sabi dito,
Magkaroon din kayo ng pananagutan.
sabi dito, wag mo na lang daw sabihin.
Pwede po magsalita.
Teka sandali, teka sandali, ha?
Good afternoon to.
Good
sa inyo
afternoon.
lahat. I'm not an epileptic. I do not have cancer. I have MS. And all doctors knows that there's no cure for multiple sclerosis. And they have given me only steroids, antidepressants, muscle relaxants, and all that. Wala pong improvement. They only aggravate my relapses every year. Nasa hospital po ako. And then it goes hanggang naglanded po ako sa wheelchair. If I have to take this risk of taking these drugs with side effects, why not take medical marijuana, which also can help tremors, spasms, and everything that I have researched from the internet, although hindi pa na dito. Pero bakit po, kung ganyan na ibibigay lang sa akin ng doctors na mga steroids, every month gusto nila akong i-steroids na nothing happens, mas getting worse pa po ako. Then, nag-refuse na po ako sa doctor, I cannot follow, I cannot obey you because ako yung nagdadala. Ang mga side effects lahat nag-manifest sa akin. So, why not take the risk of taking this cannabis na, which I'm sure, meron po ako mga MS friends sa FB na nag-contribute na mga kanya-kanyang sa mga drugs. Lahat po sila talagang hopeless sila sa mga interferons, costly pa po, napaka-expensive po. Ako, I cannot afford kasi nandito tayo sa third world at wala pong available dito. At ito rin pong marijuana, since meron naman tayong locally na just because it is illegal, hindi po ako maka-access. So I am appealing to our government to please help me po, tulad ko na may multiple sclerosis, na maka-access po sa medical cannabis. Thank you po.
Maraming salamat. We have another... teka muna, bago kasi gusto nating alaman talaga mga sinasaloob ng mga tao. Yung mga nakapagsalita na, maya-maya na kayo. Okay. Yeah, please. And then the girl in yellow and then dito, ha?
Yeah.
Okay.
Sandali. So good afternoon to all. First, gusto ko magpasalamat sa nag-organize nito. So the government and the private sector and the parents especially, and those who give time to attend this. So I have a 7-year-old kid. Okay, so sabi ko I'll not be emotional kasi logical ako coming from an engineering background, but I have a 7-year-old kid who almost died 3 years ago because of status epilepsy. So he's been having seizure since 8 months, katulad nyo rin. 5 klaseng anticonvulsant drugs na tinitake niya ngayon, maximum dosage, twice a day. Isa doon S2 drug, which is Rivotril. Though I would like to commend PIDEA, kasi si Mercury Drug talagang hindi siya papayag na magbenta kahit 0.25 milligrams of the Rivotril. Ang challenge ko kasi doon, pag ubus na yung reseta, I have to really go back to the doctor and get the S2 drug. So that is a commendation for the PIDEA agency in terms of implementation. So almost died dahil natubo siya in terms of respiratory and so simply because since nagsisseizure siya, hindi niya na alam nangyayari, nag-drop na yung oxygen level sa katawan niya. So the good thing is that he's still alive today, right? But I would like to appeal to all the sectors to work together, especially the government-led. Kasi according to the Epilepsy Society of America is that if there is a consensus between the healthcare provider, the patient, and the parent, then wag natin ipagkait yung medical marijuana na yun. Because kami mga parent na may epileptic child, I'm not only appealing in behalf of the epileptic patient, but kahit yung may mga cancer, and even ma'am who shared her, her story, is that epilepsy is not actually a science. I've spoken to a doctor in Mayo Clinic. Sabi niya, epilepsy treatment is like cooking. It's a little bit of this, a little bit of that. Kaya ang daming gamot eh. Iniiba-iba nila yon. Now, the same thing goes for the medical herbal marijuana. So, I'm more than willing to participate in the testing to support this particular endeavor. And at the same time, reality bites, epileptic patients, we don't have the time. So let's not wait for 5 years to 10 years to enact this law. I understand that there are conscious effort to do this right now, but please, let's give not only my child, but everybody's child a chance to give this quality life.
Congressman Del Monte, and then I think Dr. Sarosa, you'd like to say something?
Purpose sa open policy, no? Sa policy forum natin. I'm not the doctor, but I am confused listening to all the statements, no? I do not believe personally that marijuana can cure illness. Maybe this is a palliative measure. It only treats or lessen the pain or the symptoms. Sa totoo po lang, no? So, I have talked to a lot of congressmen in regards to this. Kailangan po i-convince natin sila, pati yung mga senador, dahil in a legislative mill, Congress at saka Senate. You have to convince them that the benefits of using medicinal marijuana will outweigh the risk, meaning the addictive component of cannabis. Secondly, they don't believe that there are no other legal drugs available having similar effect with marijuana. Dahil sabi nila, scientist masyado, magpunta na nga tayo sa ibang lugar, sa ibang planeta, hindi pa makukuha sa mga scientists, mga doctors ang derivative na similar to marijuana. So sa akin po, rest assured nga balanse po kami sa Kongreso. So I admire nga marami pong lumalabas, pero mahirap naman yung false hope nyo nga even this will be legalized, the medicinal marijuana. I don't think it will cure all your illness. It will only lessen your pain because this is a palliative system. Yun ang pagkaintindi ko. Hindi ako doktor.
Oh, let's hear from a doctor. Dr. Sarosa, what do you think?
Coming from a palliative care perspective, the goal is to enhance quality of life. If you have having a good quality of life, patients actually live longer. And at the same time, you give them a chance to, spend time with family members. And I know all of these things because I work with terminally ill patients. So I do understand the plight of our patients. So the truth now is that, one, cannabis is not a registered drug. Second, we're not allowed to cultivate the marijuana plant because it's illegal. So what I can think of right now, it's the easiest way out to provide access to this medication is that we have existing drugs outside, nabiximol, dronabinol, and cannabidiol that can be accessed through regulatory agencies. Kasi if you think about extracting the plant, the marijuana, the legal process, it would take several years before we'll be able to identify and extract that particular component. So we have the component already. We have the drugs outside. So what we can do actually is invite them over, conduct clinical trials, because if you're talking about patients, we have patients from Luzon, Visayas, and Mindanao. That's all.
Oh, thank you very much. I think Senator Sagisag would like to come back with his
If I
comment.
may, one
Sure,
or two
please.
sentences lang.
Senator Sagisag.
Dahil itong huling tatlong Pangulo ng Amerika, si Clinton, si Bush, Obama, all of them experimented with Mary Jane in their youth.
Uh-huh.
And Clinton can say so persuasively, I share your pain. Eh ano naman ang mali kung we reduce your pain? In other words, bigyan natin ng...
Sabi nga daw nila by Sir Edward, cure sometimes, relieve often, but comfort always.
Okay. All right. So I think we have some more... Teka sandali.